In the UK, British Prime Minister Boris Johnson is adamant there won't be any more restrictions imposed before Christmas. Despite charging ahead with the booster rollout, Britain is seeing record case numbers and frontline workers are bracing for the inevitable impact on the hospital system. NHS Dr Veer Pushpak Gupta has treated COVID patients in England and he joins me now from London. So the UK, it's experiencing record numbers. How is that being played out in the hospitals?
Yes, thank you for having me on the show, Meredith. We're seeing about 90,000 cases a day now of Omicron in the United Kingdom. It's gone up at least fivefold in the last 2 weeks or 3 weeks since it was first named as a COVID variant. It's now the dominant strain, as your speaker before mentioned, in the United Kingdom and many other countries in Europe. And in the hospitals, what we're seeing is that we're going back to where we were about 6 to 8 months ago, with ICUs being full again, with emergency departments being full, and in some hospitals we're treating patients in ambulances. In the hospital where I work last week, we were operating at about 120% capacity. So yes, it has had a significant impact, and I think it's important to understand why it's had that impact. Omicron is different from Delta. It's a super fast transmissible virus with lower severity than Delta. And what that does sometimes is that it spreads so fast within a population that it can overwhelm sort of your health system, and the population can be overwhelmed in the sense that even the people that have been vaccinated, some of them had their last dose about 6 to 8 months ago. So waning immunity is also an issue, which is bringing people back into the hospitals. And I think that's why Boris Johnson went ahead and gave the green light to the NHS to start doing the boosters, and hopefully we should be able to boost the population pretty soon.
How many patients are you seeing with the Omicron variant in the hospitals?
At the moment, the numbers are sort of varied. London is seeing more than 40 to 50% of the cases that are coming in that are positive with COVID are the Omicron variant. Of course, UK has a very good genomic testing, and so there are more numbers that are being reported. But I'm sure that there's a lot more than what we're seeing in the hospitals that is spreading in the community, and that's the main concern at the moment. People have sort of forgotten the basic COVID appropriate behavior as everything opened up in the UK for the last 6 months. Mask wearing, social distancing, all of these things were a thing of the past. But I think it's time that we remind people that this is important going forward.
So the Prime Minister, Boris Johnson, he has announced that he doesn't want any changes made before Christmas, kind of emphasising the fact that people have earned their freedoms and they should be enjoying them. But he's also warned people to remain cautious and to take necessary precautions. How will not increasing restrictions possibly increase transmissions?
Well, as we all know, the holiday season's upon us. People are going to be mixing indoors, and that, in my opinion, and most of the scientific community believe, that's going to slingshot the infections way forward. And going into January and February, we may be seeing more than 200,000, maybe 150 to 200,000 cases a day in the UK. I don't think, I mean, a lot of people do agree with Boris Johnson. I think that it's our duty to remind people time and again, but at the end of the day, it is everyone's responsibility to be taking care of their own health, and especially the health of the vulnerable. So at the end of the day, COVID appropriate behavior, vaccinations, booster vaccinations, all of this has significant evidence that this does decrease infection. And I think that it has to be a personal responsibility going forward that we all have to take care of so that we can limit the spread of this virus.
And you are a researcher in a trial called the Recovery Trial, I believe. Can you tell us a bit about that?
Yeah, so Recovery Trial is something that started in the UK in 2020 when the virus was first discovered, and it was basically done to try and find out treatments and various forms of treatments that we can use. So if you remember, dexamethasone was a major finding in the Recovery Trial early in 2020. That was one of the treatments, a cheap treatment that was given to patients when they were hospitalized, that decreased the spread of infection and also decreased ICU admissions. And various other treatments have been researched under the Recovery Trial over the last couple of years now. But going forward, I think vaccines will be the mainstay of treatment. We've seen enough data that vaccines do help in reducing infections. Boosters are helping. One of the main concerns that people have in the United Kingdom, especially the research community has, is that when you have a virus like Omicron and Delta raging through an unvaccinated population together in any nation, and you have a possibility of both those variants joining together and forming an even stronger variant, which has the transmissibility of Omicron, but and the severity of Delta, and that would be a truly nightmare scenario. So our aim should be to try and prevent that from happening, and try and warn everybody that that is a possibility. So we should take this seriously.
Okay, Dr. Veer Pushpak Gupta, thank you for talking us through the developments in the UK.
Thank you for having me on the show. Thank you.
A crowd of more than 70,000 spectators is expected to attend the first day